The next presentation is by Mr. Keith Simpson, who is a trustee of the association, and he's going to talk about his life with Paget's disease. So we'll just give him a few minutes to get up here, and we'll put, presumably, some slides on here. Okay.
Well, hi everybody. It's my second time standing up here doing a presentation, and hopefully my nerves will be calmer this time. I've got my notes. It's only 40 pages long, so it shouldn't be. I'll try not to sort of stereotype it. Well, my story is 10 years long, but like I say, don't panic. I'll try and do it in 14 minutes with a minute for questions. Well, anyway, it's been 10 years since I was diagnosed with Paget's disease of the bone. It really started with aches and pains in my legs and knees, which got worse over a period of 12 months. I'd had the privilege of being club captain of my local golf club, which meant playing a lot of golf with lots of walking, especially looking for my golf balls. I wasn't always straight. Yes, my favourite leisure pastime, golf, was becoming too painful to play. Back in the 19th hole, the club bar, my playing partners would tell me my pains were down to bad knees, get them cleaned out, go and see the doctor. You know, I wasn't one for the doctors, but I think it probably is a male thing, I don't know. But anyway, I did eventually go to the doctors, who referred me to see a consultant. My visit to the hospital involved having a series of x-rays which showed 2 good knees, 2 bad hips, and possibly Paget's disease. Paget's disease was a disease I'd never heard of, worrying because I knew nothing about the disease, you know, and its implications. That's the first time I visited the Paget's website. I saw an endocrinologist who arranged for a blood test, a nuclear bone scan, which confirmed I had got Paget's disease in my right femur. The recommendation at that time was not to treat the Pagets. But the problem was that Paget soon got put on the back burner because following a PSA blood test, it did lead to me being diagnosed with aggressive prostate cancer. So I had a prostatectomy, an operation to remove the prostate, and I've been free of cancer to date, touch wood. But anyway, I transgress a bit, but 2 years later, I was still suffering with pain in my leg and hips. The pain in my leg would start in the afternoon and not change even when resting. You know, it was a deep sort of pain that was sort of persistent, wouldn't go away. It was really debilitating, really. Top of my leg was warm to touch, and possibly some of you have experienced this yourselves. Yes, I became a member of the Paget's Association, and for me, the yearly AGMs, as today in the meeting, it was becoming a good source of information. A further visit to my doctor because of the pain resulted in a referral to my local hospital, where I saw an endocrinologist. He'd only seen 3 patients with Paget's in the previous years. Not something I really wanted to be told. He arranged for a nuclear bone scan which showed no spread of the disease, and arranged for me to have 6 infusions of pimidronate over a period of 6 weeks. I was very pleased that I'd read the Paget's booklet, Paget's disease, the facts. Diana showed you one today. It is being revised. Anyway, in that there is a section there on intravenous drugs and side effects. And it indicated that after an infusion, one side effect can show as flu-like symptoms. And yes, I did experience that. You know, that side effect. It hit me on the first evening, instant flu, but it only lasted a couple of days. And with a bit of TLC, yeah, I recovered no problem. The pain still didn't go away, but got worse. I mean, the problem was it my hips? Was it the femur? Was it the Pagets? Speaking with a Paget's nurse, I was told the pain could take several weeks to reduce, having had the infusions. But if this didn't happen, to go back to the doctors. In fact, it didn't reduce. 8 weeks later, I went back to the doctors and consulting with the doctor, and she phoned the consultant. It was recommended I go up to the hospital and have some x-rays done. I hobbled into the x-ray department, you know, with the aid of my dad's old walking stick. And after several x-rays, put in a wheelchair and pushed into the radiologist's office. He displayed an x-ray which was taken 2 years previous, which when magnified showed many hairline fractures on the surface of the femur. He then displayed a picture that had been taken on that day. As you can see, the x-ray shows a fractured femur. I'd been walking around on a fractured femur, so it's no wonder that I was in a lot of pain. Anyway, 2 days later, I was in surgery and had it repaired. I had a 12-inch plate and 8 large screws, and yeah, that did the job. I wonder, I didn't have a lot of blood loss, so whether it was that the pimidronate infusions that I'd had earlier had helped with that blood loss, I don't know. But anyway, 2 weeks in hospital, 6 months on crutches with no weight on that leg. I had no physiotherapy, so it did result in major muscle loss. Something that possibly, you know, now I think back that I should have had some physio in some form, even though they didn't want to sort of move the femur and cause problems with the repair. After the initial repair, I was referred for a new left hip, subject to the area being clear, because of course I've still got 2 bad hips. Concluding an assessment with the anaesthetist at that time, it was apparent I'd lost confidence in my local endocrinologist. That's my local hospital. You know, I'd been walking around on a pathological fracture. It had gone unnoticed for a while. His lack of experience in the disease, it led me to speaking to our Paget's nurse, who recommended Nottingham City Hospital, that's myself, as the nearest centre of experience, you know, in the treatment of Paget's. I got a referral from a doctor. I've never regretted it, that move. In fact, Nottingham Hospital is now one of the Paget's Association Centres of Excellence. In 2012, my now newly appointed endocrinologist investigated the extent of my Paget's activity, a blood test, x-rays, a blood scan, and it showed that the hip was taking its time to repair. Now I've lost my... As you can see, the 2 different times in the year 2012, you can still see the fracture there. Again, 13, it's more or less repaired there. So it took some time to repair. I had a trial of residronating for 2 months. That was a 30 milligram tablet, taken first thing in the morning on an empty stomach with a full glass of water, and remaining upright for 45 minutes. That was a bit different to the normal tablet taking. With no golf, I was now putting all my efforts into gardening. It was almost impossible, not being very agile, But I had plenty of time on my hands and some welcome help. Yeah, I had some beautiful results. Not there, because that's the repair. But I'd got the garden. My partner helped as well. Over the time, I had the odd visitor. Luckily enough, in that slide there, it was sort of winter time, so he didn't have all my flowers. But a monk Jack that was paying a visit. I repeatedly asked for a hip replacement, a right hip replacement, but was told it was a very dangerous operation. Not advisable because of the potential high blood loss. You know, the blood loss flow in the bone. Poor quality bone, repaired fracture, secured with 8 large screws that were in the way. Susceptible to stress fracture. The list seemed endless. I was told, keep taking the painkillers. I was now on tramadol, paracetamol, and a buprenorphine patch. I didn't know anything about paracetamol, the problem that we've been told about today, but anyway, yes, I was becoming a bit of a druggie. Not that I realised it, but friends did when they looked at me. My rise to fame was being live on BBC Nottingham Radio, talking about Pagets, the main topic being pain and treatment. Rob Layfield, he was going to be with us today, he's not, but anyway, he followed me later that morning with a professional view. I was pleased to be able to support the awareness of Pagets. Was still in a lot of pain. After further investigation, you know, that was the problem. Don't know if you can see the hip, but it was getting very bad. September 2016, I had infusion of zolidronate. The same month, at the Norwich AGM, an informations day, an orthopaedic surgeon, after hearing my tale of woe, advised me of a surgeon who could possibly give me a new hip. You know, we're sort of going on now, 2016, and I was diagnosed. I'd got bad hips in 2008. That a surgeon could possibly do it, which was fantastic news for me. Of course, he also said about the dangers of doing it, and he said he wouldn't touch me with a barge pole. But anyway, I followed that up. I looked it up on the internet, and speaking with my doctor and my Nottingham Hospital Paget's consultant, I was able to secure a referral to the eminent surgeon. The orthopaedic surgeon has a specialist in interest in hip and knee surgery. And on my first clinic visit, I was interviewed by his registrar. It was certainly enlightening and spelled out all the dangers, which obviously I've got to do. A bit depressing, really. But I was also quizzed on the need for a new hip. You know, I felt my quality of life was getting to a low point. You know, everything seemed to take 10 times longer. Some tasks were impossible to do. I was using a crutch to get about because of the problems of possible further fractures. So I knew it was my way out, even with all the sort of dangers they were saying about the operation. But I felt that sort of, surgeon's not going to operate if he thinks he's going to sort of put you under. And I don't mean under the what's it, I mean 6 foot under. So the next consultation was with the surgeon himself, who told me he could perform the operation. But going on and talking about the surgery, this is a surgeon, he'd done some x-rays. This is prior to the operation. But obviously there's a lot more work goes into it than we realise. As a patient, we don't understand the extent of what's needed. Yes, he said that what he would do, it was quite straightforward. He said he'd just take out those large screws and put short screws in. See, yeah, matter of common sense, really. If that was successful, he would continue on with the operation and do a new hip for me. He'd put a large stem in so that that would help with possible fractures because of the possible bad bone. So yes, it was fine. He would do all that. But of course it was subject to my endocrinologist ensuring my Paget's was at its lowest activity level, you know, thereby reducing the blood flow through the bone. It was also down to me personally to ensure I was in tip-top condition, no coughs or sneezes, and of course carrying out those pre-op exercises daily. So, yes, I had the operation. And if we get on to the next page. Yes, it was August the 25th, remember it well, 2017, big op day, 4.5-hour operation. It was a great success. And at last free from pain. So the metalwork's sort of enlarging by the day, you know, I'm sort of now really ringing the buzzers if I go through the airport. Golf people are sort of saying that I've probably got a few extra aids which should sort of reduce my handicap, but I don't think so. Yes, on that time really, 4 weeks later I was on crutches. I was at the information day. I was appointed as a trustee, honour of being as trustee. A further 2 weeks and I was away from crutches, which was, yeah, that was a major milestone. It was then into a slow build-up, daily walks, along with my exercise routines that had been set out by the physios at the hospital. I was enrolled at that time onto the working party regarding the preparation of the clinical guidelines on the diagnosis and management of Paget's disease of the bone. I was contributing as giving a patient's view. It's certainly been an honour to work with that team, you know, professional experts. For me personally, many of the conclusions have highlighted the need for supporting further much needed research. Anyway, now free of pain and off all the pain-killing medication, you know, my life has completely changed. This March, I was able to golf for Paget's. It was something that sort of, when I see so many people raising funds for sort of a tea party or anything like that, like I say, we need lots of research. We can't really do enough research. Lots of the conclusions were that insufficient evidence. The evidence is there, but it's just needed to get together so that yeah, we needed money for research. So I did my little bit. I couldn't run the marathon that year. And doing the 100-mile cycle ride, I couldn't do that. But yeah, certainly getting back to golf was fantastic. I mean, I got my old trolley out. The battery had been on charge for 10 years. Surprisingly, it worked. So yes, it was nice to get back to golf. I'd like to take this opportunity while up here to personally thank all the generous supporters for supporting me. I'd got a target of £1,000 and I exceeded that. And again, thank you for those people. And that really is my story so far.
Keith has highlighted really the need for further research, and obviously when we talked about the clinical guideline earlier on, we were saying about the unanswered questions. Here we are, great opportunity. Any questions? Marjorie? Sorry, do you want to wait for the microphone so we just make sure we hear you? Oh, actually, that's a good point.
There's a lot in the press about vitamin D. Do we get enough, do you think, if we're in the sunshine that we get here, or should we be taking a supplement?
Razor?
I'll ask. I'm going to ask Professor Ralston.
I've done editorials on vitamin D.
I'm going to ask Professor Ralston first of all, and then we'll get Dr. Birrell, and then myself, perhaps.
Yeah, I mean, it's reckoned that in the winter, a lot of people are deficient in vitamin D. Certainly, the further north you go, I think in Aberdeen, if you look at the biochemical levels, I think a quarter of people are deficient in vitamin D in the winter, and maybe it's a half.
I would say half
in the winter and a quarter in the summer.
Yeah.
I think vitamin D, well, it's generally important for bone health. I think I guess it particularly is relevant in Paget's is if you get like zoledronic acid or one of these drugs, because if you give that drug to people who are a bit deficient in vitamin D, their blood calcium can really come crashing down and cause all sorts of problems. So definitely if you're going to get that drug, otherwise you can have your levels checked. But a lot of people, they take vitamin D between, say, October and April. But there's debate about whether everyone should have vitamin D supplements all year. I don't believe that that's needed, actually.
Dr. Birrell.
I would say it depends where you live. So living on the south coast, as you do, and as long as you get that 15 or 20 minutes of sunshine a day. At the moment, our obsession is with sunblock and the risks of cancer, which actually, needs to be considered in perspective. If we look at pathology across the whole population, because the deficiencies are so common, actually the pathology from it is quite common. So the minute that somebody's got kind of widespread pain, there's a series of common things you need to be looking for, and that includes low vitamin D and low thyroid, and so it's a kind of thing that we need a high index of suspicion to look for in the right place. But the people who are spending 15 to 20 minutes getting their sunshine when it is sunny are at much less risk, and obviously there are dietary courses as well. What the promise that hasn't really been played out is because we have been involved in vitamin D trials to look whether supplementation is effective for treating osteoarthritis, where actually that hasn't been effective, and it's not been the kind of panacea that we all hoped it might be.
Thanks very much. Perhaps my comment is I was involved in the report from the Scientific Advisory Committee on Nutrition, which is part of the Department of Health. They published their report in 2016, and really what they concluded was, I quite accept that not everyone who living in the UK is vitamin D deficient, but to really try and ensure that it's prevented, they suggest that all adults basically should take a vitamin D supplement during the winter months. Now, really, do I believe that everyone should or needs it? No, they don't all need it, but at least by advocating that, it's I think, a wise move. I'd also endorse the comment that Stuart made about those on zoledronate. It's very important that they are made vitamin D replete. In other words, top up the vitamin D levels before treatment to prevent complications. So it's a great question.
The other point is that vitamin D supplements are very, very cheap. And the idea of they're not harmful probably if you take them in the low dose.
Now I'm just laughing because you said it probably.
Probably, yes. But it seems to me to be, with the prevalence of marginal D deficiency, advocating that people, particularly the elderly, take vitamin D maybe all year round. I mean, this summer was rather unusual, but the average summer you may be just as vulnerable as other times. I mean, I know the clinics that measure vitamin D constantly surprised by how often they find low values. So.
Yes, actually the SACN and Public Health England advocated that those at very high risk of vitamin D deficiency, the housebound older person, those with high pigmentation levels, people from certain ethnic backgrounds should take the vitamin D all year round. Right, I've got a non-vitamin D question. I think we've really given vitamin D a good airing. It's a good question. Any other questions or comments? Yeah, just wait for the microphone, that's fine. Thank you.
Right. I understand that most Pagets are discovered by accident. I think that was the case in my circumstance. Pretty similar to Keith, I played golf, found pain in my leg, put up with it for quite a long time, then went to the doctors and said, well, I think it's your knee. Go and have it x-rayed. Luckily, I got a radiologist who took an x-ray of the knee and she said, well, I think I see a change in bone density above this picture. Do you mind if I do the side? And I said, well, certainly not, you're the expert. It showed that there was a different density there. It went back to the doctors. He suddenly tumbled and took the blood tests, and it all unravelled from there. Should we be worried about people that don't get these pains, and are they suffering? Are they going to be at risk?
If I can try, I'll start with that one. Yeah, I think in your case, it wasn't exactly by accident. I suppose, right, first of all, if you go to your doctor with pain, Paget's is not the first thing your doctor is thinking about. They're probably thinking about, well, it might be a bit of osteoarthritis or wear and tear. We're ditching wear and tear now after Fraser's talk. They think it's probably a bit of osteoarthritis, but at least you got the x-ray, and then actually, you know, they twigged it wasn't osteoarthritis. So that's, I mean, I think that's fine. That's just the way it's going to go. I think there are some people, though, that in our clinic, this was about 20%, they maybe had a scan for, I don't know, a liver problem, right? And then it was found out that the patient had Paget's. But in that case, often the patient has absolutely no symptoms. But what you experienced was symptoms from your Paget's. It was causing pain, and that's quite common. That's most of the people we see.
Fraser, do you any comment?
No, I think Stuart's covered that beautifully.
Okay.